Living well. Living well really is the aim of any of the human being in our life, starting from any child patient to any adult growing patients. So what we'll try to do in our program is to give you the medical information in a very light meal and in a very simple way and language. We'll try to discuss about diseases, the causes of the diseases, the symptom of any disease, and then we'll finish by trying to treat or suggest any treatment for those diseases. So the aim of Living Well is not only yours, it's also our aim in our program to give you a very light meal of medical information in a very simple language. So just bear with us in our program and we'll try to be a very, let's say, light guest in you every week. Hi there. One of the smallest glands in the human body is the thyroid gland, which is a butterfly gland located in the anterior aspect of the neck. And in a simple way, it's the gland which regulates everything inside, almost everything inside the human body. So any abnormality on the thyroid gland will lead to a certain number of complications. Hyperthyroidism or hyperthyroid. Hyperthyroid is the increase in the activity of the thyroid gland. Usually, the thyroid gland function is regulated by the thyroid stimulating hormone and by the TSH, the abbreviation of the thyroid stimulating hormone. It will lead to either increase or decrease the release of the thyroid gland hormone, which is the T3 and the T4. So, if the level of the T3 and T4 get increased inside the human body or in the blood, then it will cause what we call it hyperthyroidism. So, in a simple way, hyperthyroidism is the overactive thyroid. So, what are the symptoms of the hyperthyroidism? One of the most important symptoms that usually the patient will complain of, that getting easily irritability. He will just get angry for a simple, let's say, situation. The unintentional loss of weight. The patient will come to the clinic complaining that he's losing weight despite the fact that his, his appetite is open and he's eating as a regular person, but he'll start to lose weight. Another kind or another symptom that usually the patient will have, especially the female patient, is the irregular menstruation. Sometimes they will just have irregular menstrual cycles or period during the month and starting to variate between month to month. As I mentioned earlier, sweating. If you just look to all of these, let's say, symptoms, most of these symptoms are related to the high metabolism that usually will be there in the hyperthyroid or the overactive thyroid gland. Another kind of symptom that is related to the size of the thyroid itself. For example, some of the patients will complain of difficulty in swallowing, snoring during sleeping, sometimes even difficulty in breathing. And all of these symptoms are related to the size of the thyroid gland itself. Getting irritable and, as I said, very nervousness is really a characteristic of the hyperthyroid, along with anxiety and change in the behavior, with also hair thinning. All of these are symptoms of hyperthyroid rather than hypothyroid, which is the down, let's say, activity of the thyroid. So the overactive thyroid usually will produce these symptoms, and the enlarged thyroid gland will produce what we call it compression symptom, either on the trachea or in the esophagus. So it's either the breathing symptom or the eating, let's say, symptom or swallowing symptom. So the complications of hyperthyroid are usually related to the symptom that the let's say the overactive thyroid will produce, or the size or the site of the thyroid gland. One of the complications of thyroid gland, which usually the hyperthyroid usually affect the eye, is what we call the Graves' ophthalmopathy. The Graves' ophthalmopathy, it's a protrusion of the eyeball that usually occur as a result of the hyperthyroid. So you just see the patient who's staring and his eyeballs are usually protruding to the anterior aspect. The complication of Graves usually will be dry eye, increase in the tearing, for example. Those, let's say, dry eyes usually will be more prone to infection, and then the complication of hyperthyroid itself on the eyeball or the eye cavity ball. So why it's important to discover hyperthyroid in an early stage? It's important to avoid the complication of the hyperthyroid in the heart, in the eye, in the bone, or even in the skin of the patient. Unfortunately, hyperthyroid have many complications on the patient's situation, and it's very easy to be discovered by performing a simple blood test. And then sometimes we need to go, let's say, to see the size of the thyroid itself by doing an ultrasound. And then sometimes thyroid scan and uptake is really important to be performed. The treatment of hyperthyroidism usually will depend on the site and the symptom that the patient has. The main issue is to decrease the activity of the thyroid, either by medication or by radioactive iodine or by surgery. And also the same thing applies to the complication of hyperthyroidism.